Hey everyone, and welcome back to the channel. Today, we're talking about something almost all of us have experienced: headaches. That throbbing, pulsing, or constant ache in your head can really ruin your day. But have you ever wondered what's actually happening inside your head when you get one? Let's break it down. First, a surprising fact: your brain itself doesn't have pain receptors, so it can't feel pain. The pain we call a headache actually comes from the tissues surrounding the brain. Think of the blood vessels, the arteries and veins, and the protective layers called the dura mater at the base of your brain. These structures are very sensitive. When they get stretched, inflamed, or distorted, they send pain signals and voila, you've got a headache. So what causes these structures to get irritated? The reasons are incredibly varied and can be grouped into a few categories. Let's start with what's happening inside your skull or intracranial causes. Things like inflammation from meningitis or an abscess can cause severe headaches. Also, changes in the pressure inside your head, both high and low, can trigger pain. For example, some people get a headache after a spinal tap because it lowers the pressure of the cerebrospinal fluid. Then there are causes outside the skull or extracranial causes. This could be something as simple as inflammation on your scalp, like a boil. More often, though, it's what we call referred pain. This is when a problem in one area causes pain in another. A classic example is eye strain from needing glasses or from glaucoma. Problems in your middle ear, sinuses, teeth, or even neck issues like cervical spondylosis can all refer pain to your head. Beyond these local issues, general body conditions can also be the culprit. These are systemic causes. Have you ever gotten a headache when you have a fever? That's a toxic factor at play. Other things like low blood sugar, certain medications, or even anxiety and depression can trigger what's known as a tension or psychogenic headache. These are actually among the most common types of headaches people experience. So how do these different causes create the sensation of pain? Well, as we mentioned, pain receptors are found in the blood vessels and meninges around the brain, as well as in the scalp muscles, face, sinuses, and teeth. When these receptors are stimulated, either mechanically by being stretched or chemically by substances like serotonin and histamine, they fire off pain signals. For instance, an intracranial mass can physically push on these sensitive structures. The pain gets worse when you cough or sneeze because that action temporarily increases the pressure inside your head, further displacing them. Now, let's talk about the patterns of headaches because they can give us important clues. A single, sudden, and extremely severe headache is a red flag. It could be caused by something serious like a subarachnoid hemorrhage or meningitis, though it can also be the first sign of a migraine. If a headache develops over days or weeks and keeps getting worse, it's crucial to see a doctor, as it could point to a serious underlying issue. What about headaches that keep coming back? These are often recurrent headaches. The most common culprits here are tension, migraines, and chronic sinusitis. For headaches that have been a recurring feature for many years, they are very often tension-related or migraines. Finally, let's touch on management. The most important step is always to treat the underlying cause. If your headache is from eye strain, getting the right glasses can solve it. If it's from sinusitis, treating the infection is key. For the very common tension or psychogenic headaches, management is a bit different. Simple reassurance from a doctor can be surprisingly effective. Over-the-counter analgesics or pain relievers can help. In some cases, tranquilizers or antidepressants might be prescribed if anxiety or depression is the root cause. And don't underestimate physical treatments like massage, which can work wonders for releasing muscle tension in the neck and scalp. It's always important to remember that if you're experiencing severe, persistent, or changing headaches, you should consult a healthcare professional to get an accurate diagnosis. They can help you find the cause and the best treatment plan for you. Thanks for watching today. I hope this helps you understand a little more about what's behind that ache in your head. If you found this video helpful, give it a thumbs up and subscribe for more content. See you in the next one.